The Maryland Health Department reports that there has been a spike in heroin-related deaths across the state, an 88% increase since 2011. That translates to 464 deaths by the opiate drug in 2013, compared with 247 in 2011. Meantime, prescription opioid or painkiller-related deaths have remained relatively stable. We asked Prince George's County Police if this increase is affecting local residents.
The narcotics department, basically, I would say, on a scale, balance prescription drugs with opiates and heroin. How are they both dealt with, or is one seen worse than the other? How is that?
That's a good question, and I'm glad you brought that up, because we, in our agency, like all other agencies, try to stay ahead of emerging problems. And this is a big emerging problem because of the overdose deaths. That's a specific and specialized kind of drug investigation because of the pharmaceutical part. So we have detectives who are trained in that specifically. They also work directly with the federal task force. The federal prosecution of a drug dealer in Washington, D.C. in April, he was just sentenced to 30 years because his heroin dealing led to 3 overdose deaths. So this is something that every agency is targeting. Our agency, we're and the Narcotic Enforcement Division specifically, as far as the pharmaceutical part, our efforts in that particular task force in that area are very strong right now, more than ever, because of the rising overdose death problem. And that again, the increased public awareness of the problem, and then targeting the pharmaceutical opiates, that's the root problem, and that's how we're targeting that.
Now, the highest rates of Maryland heroin-related deaths are in Baltimore City and Baltimore County. Tomorrow, Governor Martin O'Malley will address the issue at the Annapolis Police Department.